Friday Mailbag is about questions that patients have that we bring to the table. So thank you for those who are asking them. Thanks for your questions. We appreciate it, and we want to bring value in terms of reality. What's important to you is important to us. Enjoy. Thanks for listening. If you like the candid discussion and are seeking the truth behind the mainstream narrative, then please subscribe and share. Not only am I grateful, but those who seek the truth and wish to empower themselves and their family's health, freedoms, and future will also be grateful.
All right, do you want me to, oh boy. All right. Oh boy.
Whoa, that was loud. Easy
Sorry,
there, Charlie. You got a snout on you. Hey, we're here with the Schnauzer brothers. Beaks to boot. Hey, beaks to boot.
Beaks to boot. Oh, I got you beat. I got you beat.
Let's see the profile there, Schnauzer.
Yeah, hold on, wait. Wait.
Wow. Turkey. Nice. McGurkin. You are Turk and McGurkin.
Is that microphone better, I hope?
You sound fantastic. How do I sound?
You sound marvelous.
How do I sound?
Marvelous. How do you, all right, we're recording. I don't want to really
go ahead.
How do you do the earbuds and then the microphone? Because doesn't that, I don't know.
It's the same thing you've got. I just got different earbuds. Did it?
Okay. Because this is plugged into each other.
So yeah. Look, mine is plugged in too. Look, it's just the same thing. Instead of your black one going in there, my white one goes in there.
See? It's that simple.
You crack me up, brother. All right. So today we're talking Friday Mailbag. We got some questions and some cases that come in, and patients have questions. Yesterday I taught a webinar. First one, and the request was a lot on inflammation. So, Dr. Frank, I want you to kick off your case this morning because last time I did. So what do you have as a mailbag question that came up this week?
Well, as far as a question, it was, let's just say that the patient presented with...
what's that noise back there? You got a radio playing?
Can I turn that off? Hold on one second.
Please. Hey, when you walk, I can hear your diaper.
You can hear my pamper in my pants? You heard my pamper in the pants?
You're such a hoser.
I got pampers. So, this microphone is like uber friggin'.
Go ahead.
I think we could pick up like an ant farting in New York City right now. You know?
Hey, I just got overheated. I'm sweating now from laughing so hard.
You broke sweat? Yeah, I broke a little sweat. I feel a little perspiration.
So what's your question today?
The question, it was more than a question. It was a presentation of a patient that came in and had crazy numbness, just numbness into the fingers, into these three fingers. Anybody familiar with that one? In thumb, index, and middle finger. It's pretty common where those three fingers go numb. And the caveat to the story is that she wasn't sleeping. This particular patient wasn't sleeping for a good solid 7 months. Like, the oldest form of torture known to mankind is sleep deprivation. If you didn't know that, now you know. Because when you lose sleep, you kind of lose your mind, right? And so anyway, she came in and she came in for the numbness, but yet there was underlying non-sleep issues, and so the outcome was very good. I mean, any of the listeners or viewers that can relate to any kind of a numbness, whether that be in your upper extremities into your arms or lower extremities into your legs and feet, you know that it's not fun. And it's annoying, and you kind of almost want to like shake it off. You feel like you could shake it off, but you can't because it's coming from inside and the nerves being irritated. So simple solution, simple story. When you balance the body behaves, the body works, and the body feels great head to toe. So fast forward, we did a patient testimonial with this particular person I'm thinking of, and she came to me for the numbness, so the sleep was kind of like a back burner issue, but really not the issue, but certainly just equally as important of getting rid of her numbness. And in the video, she had brought it to light, and she said, I just want to thank Dr. DeLillo for the fact that I am now sleeping. Now, this particular person is, graduate school, went on to do great things academically, and was working, I believe, 80 hours a week, lots and lots, working. And again, with the sleep deprivation, probably not such a great combination. So she had some other underlying issues that I won't go into, but let's just say a lot of people are talking about comorbidities nowadays. She had some of those, and I will see in time with further testing, but I believe that helping her with the numbness and the sleep, I believe that those comorbidities are going to be good. What's funny about that?
Oh my God. All right. So thank you for that, by the way. Was that a question, by the way?
Yeah. Was it? Could you put a question mark on the end of that?
Was there a question? Okay. Friday mail case. We're going to call that one, but I'm going to go back to the Friday mail bag. Would you tie in? So you just alluded to, here's a case with numbness and tingling, and there was all this other history behind it, and the fact that you were working with the numbness and tingling and freeing up the nerve supply, and the body starts to rebalance and heal, and she's feeling better. All of a sudden, she's sleeping better, and she's more balanced too, is what I heard. Is that correct?
That's correct.
Yeah. So there's this overall influence. Did you have anything else you wanted to add on that?
So I guess the question would be, can you help me with my numbness? There's a question. I have numbness. Can you help that?
Can you help me with numbness and tingling? What do most people think that is, by the way? If it's a woman, what do they think it is?
Well, it depends on, I guess, what arm are you getting at the fact that it could be a stroke? Is that what you're saying?
Or
yeah. Or heart attack?
Or heart attack, right? Because
yep.
that's what mainstream will teach us. And at the same time, that's not a bad thought to have, but one of the things we were taught, I recall this in teaching as well, let alone being a student, was when you hear hoofbeats, you don't think of zebras, you think of four-legged animals. So the first thing is you look at what's most obvious. As chiropractors, we know that the symptoms in the numbness, tingling in the hand has multiple causes. The first one we're going to check is very foundational, which is there any, it's in my opinion, one of the most common causes, which is neuroarticular dysfunction, which means there's misalignment in the neck or the upper back or somewhere in the spine that's actually inhibiting the flow and circulation. And yes, it could be hormonal. Yes, it could be heart. Yes, it could be many things. It could be food sensitivities that are creating this. But the bottom line is structurally we can impact the whole system. Like Dr. Frank said,
that's crazy. You hear, that's literally the traffic outside. I can't help that. But yeah, that was a motorcycle. So to your point, will we as chiropractors, Dr. Wade, will we rule out things of that nature? Of course we will. We're not going to go into it blindly. It's not like we're so blinded to the fact that every single possible thing for the body is from exclusively nerve interference. There's other factors like you just spoke about. So, we're going to be smart. We're going to be knowledgeable. We're going to do the best thing for that patient. And we're going to approach it with open eyes and find out exactly what's going on and make sure that the person's even a candidate for what we do. Let's say that.
Right. Yeah, absolutely. And that's part of the clinical expertise when we talk about what we're doing and how long Dr. Frank and I have been at this. So 53 years combined, or 54 almost now. So, 26 years for me, 27 for him roughly. So the exposure of knowing for example, and this isn't my mailbag question, but yesterday a patient came in and literally is a thyroid patient, is a hypothyroid who's been on meds for years, Synthroid, the synthetic version of thyroid medication, which is levothyroxine. And there is some concerns. There's some concerns that I'm always watching, and that's where she, functions in this medical world with it. And I'm supportive, but we're doing everything we can holistically. And the symptom that she came in with was specifically difficulty swallowing, and it's been going on for 3 weeks. And it's not a sore throat. It's this I'm choking on water swallowing. I'm having a difficulty swallowing. My first thing is with her history is you need to rule out. And I said, have you had an ultrasound? And she said, no, not 10 years ago. And I said, well, it's going to be tough to get in now with the COVID. They're not going to want to see you, but actually maybe they will. But with your history, maybe your doc can line that up. The real point was, I said, what I found in your neck today definitely affects the throat. We'll start there. In the meantime, you need a second opinion to rule out anything pathologic, to make sure that you have peace of mind and go, hey, it's not that. We can hang out here and now try to improve it. So what are we really saying? I'm not saying as a chiropractor, I'm going to fix that. I'm saying I know neurologically, and the patient understands this as well, because we've communicated over the years and she gets what we're doing. We're helping her body function, like Dr. Frank implied and stated, that we're helping the body function more normally, more optimally, to increase its adaptability. So if the nerve supply that goes to the throat is impinged, well, you're not going to get a normal throat function. You're not going to get normal muscle coordination with those smooth muscles. And there's many things that disrupt it. There's a lot of stress right now. There's other things that could be wrong. But as we tier the approach, A, I want to help her function, and B, rule out some other pathology. And then we can circle back around and go, where do you need to be for your peace of mind? And I ask the patient. I don't tell them as much as it's like, what do you think you need to do? Well, then go do that so you can relax and breathe, right? So what co-coordinating care is your patient having?
Co-coordinating care?
Yeah, I mean, medically, what's going on with the numbness, tingling? I mean,
Well, good question. So so to that point, she had gone in the history that I took with her, she had already gone to a cardiologist. She went to a neurologist. Doesn't really matter what they said to her outside of the fact that everything was okay. There was no crisis. There was no physical blockage. There was no damage. Of course, there was recommendations of medications, and for both, for a heart. I'm going to say it this way too: a heart problem that she didn't have, a blood pressure problem that she didn't have, and some nerve related. I don't even know the names of the medications, quite frankly, for the numbness, but I'm sure they're out there. I think Neurontin or something like that comes to mind. Mm-hmm. But she didn't take any, and she did fine. She's sleeping normal, and the numbness is gone. And she backed off on her hours a little bit just to help things out and not be killing herself at 80 hours a week. So she had done that prior to coming to me. To your point, would I have sent her for those things if I was, not sure as to what was going on? Of course. I think one of the things I want to say right now, Dr. Wade, just based on what you're saying, and for the listeners and the viewers, to you and I, it's just a very simple idea. It's part of our world every single day for the last, like you said, 25 plus years. I think what I want people to know is there's a huge difference between crisis care, emergency medicine, and healthcare. Like literally getting healthy is a completely different vibe. For example, someone's appendix is bursted. They're on their way to going into sepsis. They're not coming to you and I for an adjustment, right? Simple. Like I know, some people would be like, of course, duh. Are you kidding me? I mean, I'm not even going to the chiropractor for anything outside of my neck and my back. Okay. I get it. But I'm saying there's other things that are affected by a chiropractic adjustment because of the way the nervous system works. Not my rules, just because of the way the nervous system works. But there's a difference between being in crisis and needing emergency medicine attention and getting someone healthy. So that's kind of what we're talking about, but I just think it's an important point to illustrate.
Mm-hmm. That's a good hit. Why don't we come back around to those three? So you got healthcare, you got emergency medicine, and you have, what was the third?
I think I called it crisis. I don't know why I broke it up that way, but you understand the point. I want to hit all angles so people understand what I'm saying, right? So like an appendix bursting, If you have a heart attack already, that's one scenario. It's like it's already done, or there is heart problems. There's blockage. There's damage. There's something damaged to the tissue. That's a scenario. But if you go to the doctor and your blood pressure is like I don't even want to give a number, but let's just say that you were told that it was elevated and nothing has happened yet. That's a different scenario where you can get your body balanced and maybe make some nutritional changes and lifestyle changes and not have high blood pressure anymore. That's what I'm saying.
Right. So we can talk about that in a bit. We'll talk about between visits. Like, what do you do between visits? What is the average American taught about what to do between visits? I'm going to bring up my case here real quick, my question. The question I had this week was on bladder. Okay, this is a cool question. And I'm going to qualify because the same question came up about 3 weeks ago, 2 different women. Okay, and the question came up, I have a bladder infection right now, Dr. Ananson, and I don't want to go on antibiotics again because I have in the past. And I don't know why this is happening now, but can you help me at all with it? And my first question is, where's this patient coming from? Like, what are they really asking? Okay. What are they really asking? Are they asking for me to offer some nutritional advice? Are they asking me to fix something? What are they really asking? Or do I treat that? And so I said, well, first of all, you said you've had them before. What stage are you in? Are you in a lot of pain? Yes, it's burning. It's been happening. I've been using Cran tabs. It's not that much better. It's only a little bit better, maybe 15% better, but it's still happening and I'm concerned. So I said, all right, well, here's what I'm finding and here's what we can do to help. So I adjusted and then I said, let's follow up in 2 days and make sure you're holding specifically in this area that actually is around the kidneys, bladder, and obviously the sacrum and then upper cervical, but which is now we're talking about the whole spine. Again, because it's not just linear, as you know as well. What I explained to her is a lot of times, and by the way, this individual has stomach and digestive problems, and she had food sensitivities, and so she was getting on board with that, but not being diligent. She's kind of like not bought in, but being compliant and even partially compliant, just entertaining the idea, which is a natural evolution from not knowing to knowing and getting information to build on knowing, right? Mm-hmm. So it's that knowing-doing gap, and we were actually increasing the knowing. So as this individual, back to the question, was how can you help because I don't want to go this route, there's a door that opened that said, okay, she's open to some possibility. And then I said, are you also interested in utilizing something that actually is an enzyme that actually supports the health of the bladder, not treats bladder infections, doesn't treat the bladder. It actually supports enzymes specifically to that organ area, not just digestive. Okay. It also has in it what's called a lithotriptic enzyme. And what that means is stone-eating enzyme. What? Stone-eating enzymes break down crystal stones in the body. What else has stones? So then I find out by asking further questions. Is there any history of bladder infections or kidney or bladder or gallstones in your family? Yeah, there is. Now we're talking about a familial trait, genetic history, an epigenetic window that opened up because of the chronic stress this young lady is under, poor dietary habits, and not listening to the body and trying to plow through her life. She runs herself down, and that's her weakness. Make sense?
Yep.
Boom, get her adjusted, increase the nerve supply. We've done that before, but we didn't add this other piece. So nutritionally, we help support that part. We high dosed it in original in the first 2 days, came back 2 days later. I feel so much better. Oh my gosh, this stuff really works. Now, my point for saying that is we're not treating that bladder. We're treating the whole body uses enzymes, and metabolically, therapeutically, reparatively, functionally, immune response wise, all uses enzymes. Everything is dependent on them, right? So the power of adjusting the nervous system in the body, in the spine, to enhance nerve flow, and then supporting with healthy nutrition or very specific nutrients and enzymes that can help the body catch up. This young lady is back up and moving, and the 3 week ago completely cleared up. And the funny thing is, they crossed paths in the office, and the previous one overheard a bit of that conversation, and is just like so excited to contribute some of her success 3 weeks ago to this young lady. So it was really cool. But the question is, can you help with a bladder infection as a chiropractor? And is there another alternative to antibiotics or what I normally do to kill an infection, which is actually an inflammation of the bladder, which is a weakened tissue that allows bacterial and imbalance with the pH and bacteria to be present in there. But really, and what stimulates it? Sometimes it's increased sexual activity. Sometimes it's a soap irritant if it's something, bathing or something new or whatever it is. But it's not always that's the cause. It's that the tissue's weak, as you know, Dr. Frank. And so the cool thing is to come back around and see where that piece is, and then be able to have an alternative for it. So absolutely, there are natural things you can do that work extremely well. Now, is this woman, by the way, the last piece, is she always dependent on that enzyme? No, not at all. In fact, once you start to reestablish some health and teach where that weakness is, and also increase the neurology, the body can come up to, let me see if I can get my hand in here, come up to a whole new level of function. And then you don't have to drop down to this bottom all the time and come back to this, like, I'm in, I'm out, I'm in, I'm out. It's more like, how do you build health and then support health, and then you maintain a healthy function?
Back to the scenario where you said I was wondering what she was asking. Go a little further there. What do you mean by that? Because I have a thought that I want to share about that. I just want to see what exactly you meant. You were saying, like, were you asking the question to yourself, how open is she to what I want to do with her? Is she open to a natural approach? Was she really asking me about one thing but meaning another? What did you mean by that?
All those questions right there. In that, one of the things, as one of our mentors, Dr. Frank Savinsky, used to teach us specifically was, listening, the art of listening to what is said and what is unsaid, and really hearing the patient. What are they after? What are they really asking me? And for me, it isn't a skepticism and like overly introspective. It's more, can I just be present and not assume anything? And can I really hear what's inherently being asked? Can you help me? Am I in trouble? Am I in deep trouble? Or Dr. Anderson, do I need to go that route? Because I'm afraid to go that route because I've been that route and it's messed up my gut and it's put me in another situation. Mm-hmm. And so then it's, what is she asking for? Is she asking for information about, because if, to your point, if she asks, or the patient asks, hey, doc, I'm thinking about doing this. What are your thoughts? I'm going to start with, that's a great question. What do you think? Why do you think I can help? What is it that makes you think I can help? Because maybe you helped me with this, and this, and that's been effective too. And now I know, hey, I'm open to maybe a change in care. I'm open to maybe some recommendations at home. Do you have any ideas? But again, it just gives me the foundation to make sure I'm asking for what the patient's asking for and what they really want to see happen, versus not listening and going right over here. Like, hey, I could have easily been fearful and said, you need to go back and see your doctor because antibiotics are the only thing that's going to fix this.
Mm-hmm. And I think that's probably what I mean, again, I don't know the person. I'm hearing this story firsthand, just like everyone else listening to you right now. But on a global perspective, I would just say that I think she was suffering from a global point of view, and she didn't want to suffer anymore. And she wasn't sure if going to you could take care of the problem that she had. And she trusted you enough, and she does trust you enough to ask the question and say, if this is crisis medicine, if this is emergency medicine, if this is something out of your scope right now, Dr. Anderson, will you be able to tell me? And will you and she knows that you would tell her, can you tell me if I have to go that route, or is this something that you can take care of with me?
Beautiful. By the way, here's a point to your part of, because I know your question. I wanted to make sure I answered your question, number one, and I don't know if I did. She basically, here's how I approached it, much like I approached it yesterday. I said, let's tighten the window. Let's follow up with you in 2 days. And in this case, I said, let's follow up with you tomorrow. And make sure what we're doing is having an effect. Boom. Number one, because I expect results. I don't expect, I'm going to adjust you. You should be better. No, I expect results, just like the patient, because I am one, like you. Follow up. Make sure. And I said, and I remember saying this to her, given the scenario, in a couple days, we're going to know if we can help or not. And if we can't, I'm going to refer you to get the help you need. Because you said trust. I agree. And I will not betray that trust. That's the whole point. This is based on trust and relationship. I had a relationship. She felt familiar to ask, which was great. We built that. We got to that point after months of care. And this was a whole new problem. So we have a relationship. She asked her doctor. Her doctor says, hey, I know you, but you know what? I'm not going to presume to assume anything. So how about I find out more information to see what's right for you and where your head is? Because if you're fearful and you feel like this, I'm going to say you better go see your doc and make sure you rule this out right now. If you've been suffering for 3 weeks and you can't even sleep through the night and you can't function, you do what you got to do to function today and get better and not, and I care that patient is where they need to be and feels comfortable enough to know they're going the right direction. Not always comfortable, but comfortable enough that they are doing what's best for them.
Something you just said sparked this thought. I know you've been in this scenario many times, and so have I. And it's for the listeners. It's for us. It's for the listeners as well. But we were talking, you and I, last night about putting a question mark at the end of a statement to make it a question, right? Because a lot of people will try to ask you a question, but they really didn't ask a question. They made a statement. So there's a scenario right there where if someone does present to us and says, hey, Dr. Anderson, I was thinking about going to a urologist because I've got this bladder thing and I want to know what your thoughts are on it, right? So that's a different scenario. It is a question, but it's almost like that person made up their mind already that that's what they want to do. And not that you and I are going to give our recommendations based on that or what we think they're saying or whatever. We're going to confirm that. But the point is, we have to follow through and we have to follow up appropriately so that patient feels sound, heard, acknowledged. And if they did in fact make that decision without knowing that they already made that decision, I'm going to let them go and do that. Hey, Dr. Frank, you know what? I got this left-sided numbness. Do you think it's a heart attack? I think I should go to a cardiologist. What do you think? I think you should go to the cardiologist. Go get that checked out. Make sure that it's not, and then get back here. We'll get rid of the numbness.
Yeah. Rule that out. And if
I'm not going to play around with
right.
heart attack. Right. I mean,
right.
Not all, and you and I both know, and I'd like the listeners and viewers to know that not all left-sided numbness into the arm is a heart attack. Yeah. However, we're not going to take that lightly because it could be. So we're going to make sure that that's not the case. And then we're going to go to work and get it better.
And what's cool about what Dr. Frank just said with this too, to build on that, is the awareness of knowing what's right, the training of hearing what a patient's request is, like hearing and listening. I can hear you, I listened, but can I hear? Right? Did I hear you? And by the way, there's body language that we can't explain right now. There's a question we're verbalizing, but there's body language in front that is either genuinely where it is, or it's really not accurate or not congruent. And so that's what we pick up on as well. Like I said to a patient the other day, I said, you know what? I just said, I can't help you. You want me to fix you. You're coming in here and you're not changing anything. And now you're demanding that you're disappointed because you're not better yet. I told you when we started, I said, this can take months because I'll preface 45 years on a PPI, a proton pump inhibitor. 45 years. Do you know how much destruction is there? That's a whole nother topic, Dr. Frank. We can come up with that. We'll talk about reflux and antacids soon, because what I was just teaching yesterday, I can't teach that. I taught it in 35 minutes, but it requires more time, and it's only part one. Watch for an upcoming episode, the destructive nature of proton pump inhibitors or antacids, period. Antacids, Tums, Rolaids, Prilosec, Zantac, those meds will destroy your protein digestion and therefore leave you in a lack of reparative state, which is then ultimately going to mean inflammation, arthritis, degenerative disc disease, chronic spinal problems, early premature degeneration.
So what would you say to the person? Because as you say that scenario right there, especially with the acid reflux medication, and someone being on it for 45 years, right? Is that right? 45 years. I wouldn't want, I'm going to preface it by saying this. I don't want one of your patients or one of my patients or anybody for that matter to be listening to this right now and watching this. And we say something like, if you've been on medications like that for a long period of time, this is what could happen. It's not only what could happen, it's probably what's going to happen. I don't want to put them into that fear, but however, I'm glad you said what you said, because that's the reality, whether we like it or not. I've got patients come to mind, like they just start rolling into my head as you say that to me, and say things like, I do zone technique as we've spoken about. So zone technique is there's points on the back of the head that correlate with different systems in the body, and zone 4 happens to be the digestive zone, and that is commonly, not always, but commonly associated with an acid reflux problem, something with the digestive system in the stomach. And I say, how's your digestion? No problem.
Yeah.
Okay. Any indigestion, any acid reflux, any nausea, any gassy, bloated feelings? Oh, I've had acid reflux for the last 30 years.
But yeah, I'm going to stop you.
Yeah.
No problem. How's your digestion? No problem. I agree. 75% of the time, that's an answer. They're not hearing. They don't get what that means. Go ahead. But yet they have those issues.
And to your point, and again, I'm not faulting a person for this because they don't know, but I want to bring it to light because I want to help them. And I know that being on that medication for long periods of time is going to be to their demise. No question about it. So they'll say something like that and say, no, my digestion's good, but I've had acid reflux for 30 years, but I take medication for that. It's good. It's like, so now the medication is stifling and pushing down that acid reflux problem, and symptom wise, they're okay. But yet, to your point, you talked about arthritis and joint pain and all these other things. They've got all that stuff. I mean, to the nines, right?
Yeah.
Tilting to the nines. So, anyway,
so let's get it. Let's save this piece. That was awesome. Let's just save that for an upcoming show. And the reason is I want to give it ample time and ample appropriate depth, because people need to understand the difference here. And what Dr. Frank just alluded is there's a lack of association to what a digestive problem actually is. And that's why with the course I'm teaching is an awareness. First people are asleep to the problem. They have it. They're just asleep to it. They don't know why they can't hold alignment or why their joints are always inflamed, and they're told it's just old age and that it's arthritis, which really neither is a solution and neither is a true answer. It's the effect. So what do we do about it? Well, that's where we start to understand that if you can't absorb nutrients, blah, blah, blah. I, again, don't want to get into all that right now and do it at any discredit. But to Dr. Frank's super, super, super brilliant point is having that conversation with somebody is like, we're just like, you have the problem, but how do I get you to realize you have that problem that's affecting the real reason why you're here?
Mm-hmm.
And then what?
Welcome to our world, people.
Yes, welcome to our world. We go crazy trying to communicate stuff. Well, Dr. Frank, thanks for the awesome insight and also the deep interrogation to get me to the questions that you've asked, which helps me think about it and understand exactly all right, how to communicate some of this stuff. Thanks for sharing your mailbag.
Exactly. That was a good one last night. That's awesome.
But
I will put a question mark the next time. I promise. I'll put a question mark, not a period. I won't make a statement. I'll have a question mark.
All right. Yeah. By the way, people, share this with somebody that you know that might have numbness or tingling in their arms and hands. Look for a solution. Find a chiropractor. But share this with them. I mean, this is for you. This is for you to share with friends, family members who don't know, who've tried, who are on meds, who don't know other options, who are trying to build awareness and understand. Please share this. Like us, whatever you need to do. I know we don't hit that hard, but again, this information needs to be shared for patients.
And also bladder problems.
And bladder problems. Thank you.
Right.
Yes.
Go figure, people. Right. Bladder infection. Not to get off on a tangent, but I do famously with bladder infections. I really do clear them up. Yeah. All the time. What I like to share with people is, yes, like it and share it and love it and share this information with other people. We've also started a Facebook group. It is called Adaptability and Connection Secrets. Adaptability and Connection Secrets. Feel free to go and join. My wife is in charge of that. She'll click you on and join. You'll get a free PDF. 6 proven steps to adapt and cope with stress, I think is what I called it. I don't remember the title of it, but it's chock full of information on how to adapt and connect back to yourself and others and the world and adapt at a higher level so that you can cope and deal with stress at higher and higher levels and much better so that you don't break down.
Beautiful. Love it. So that you can check that out on Facebook. Start with Scotch Plains Chiropractor. That'll get you in the right direction if you didn't get that name, and then just replay this for exactly which one that is again. So that's awesome. Thanks, Dr. Frank.
Dr. Wade, have a great day.
You too, brother. Ciao.
Ciao.
Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share, so more of our brothers and sisters can grow to realize their voice and their health freedom. Speaking up means you matter, so get on it. This podcast is for information purposes only. The statements or views expressed are not medical advice and are not meant to replace the advice of your medical doctor. This podcast, including Dr. Wade Anderson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or products. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical condition, consult your licensed physician.